This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to another episode of Impact Healthcare, and this is cool for me. I've been in the insurance industry my entire career, and very rarely do I get to speak to another Latino, Latina on our podcast. So, Deanna, welcome to Impact Healthcare. For people that maybe don't know who you are or your great company, give me a little bit of an introduction.
Yeah, absolutely. Thanks for having me, Lester. Much appreciated. So I'm Deanna Miller. I am a benefits advisor with Conor Insurance. I am from Bogota, Colombia, and I'm actually situated now in Dubuque, Iowa. So I'm in the upper Midwest of the United States, and just excited to be here chatting with you.
Awesome. I've got two questions one I don't ask everybody, but one that I do. One is, how does a Colombiana end up in Iowa? So that's my first curiosity. Somebody took a wrong turn somewhere, I think. And the other is, everybody that plays in the space that we play in, right? I call us the salmon, right? We're swimming upstream. We're trying to do all the different things. Does so for a reason. There was either a point, there was a mission, there is something that fuels us. I'd love to know your why, what gets you up every day out of the bed, fueled up to fight.
Yeah, for sure. So the first one is always the $1 million question. I grew up in Bogota, and then the school that I went to was founded by American nuns. So it was an all-girls school that had English as a kind of an immersion program for kids that went to that school. And so those nuns were from Rochester, Minnesota. And for the top high school graduates, the seniors of every class, they would offer 3 scholarships, the top 3, to one school in the Midwest. So I was one of the top 3. They showed me a map because I had never been to the upper Midwest of the U.S. and said, okay, there's 3 schools here. One's in Minnesota, one's in Wisconsin, and one is in Iowa. Based on what you want to do, where do you want to go? And I just kind of looked at the map and I'm like, well, Iowa seems a little bit closer to the south, so I assume the winters won't be as bad, like I won't have much snow there. Let's go with that. And surprise, surprise, I'm still in Iowa, suffering through the winters with lots of snow, but I wouldn't have it any other way. So that's kind of how I ended up in the Midwest. And
awesome.
Yeah, completed my college education through the Loras College here in Iowa, and then just met my husband through school and just kind of stayed around here, settled with our family. So
awesome. And your why? What puts fuel in your tank?
Sure. So for about 9 years, I got started in the benefits industry with a local agency. And my predominant responsibility was to work with the Blue Cross, United Healthcare, Cignas, and Aetnas, negotiating the renewals for all of our clients. And what I was able to see was so much of the misaligned incentives that come from all of the overrides, the bonuses that are provided to these agencies just to keep business with these specific carriers. And in addition to that, kind of the negotiation gains that come from things like no shop offers, where basically an insurance company will say to an employer and their broker, if you don't shop us this year, we will give you a 2% break on your 20% increase. Or if I can, put 2 of them to compete against each other, so say a Blue Cross and United Healthcare, they'll say, well, because there's competition, we'll give you 2 to 3 points off of your renewal increase, just for that, for the plain point of saying you're getting shopped. And so that was, it just kept feeling wrong. Like I felt dirty. And then in having conversations with employers and their employees and saying, hey, by the way, this year, your premiums are going up by another 20%. congratulations, by the way, your deductibles are also going up for employees. Delivering those news is awful. It's a really bad feeling. So eventually I got to a point where you just can't do it anymore. I started looking for, there's got to be a way. There's got to be something different that we can do for employers and their people. And just happened to be on social media. That's one of the good things about it. Came across people like David Contorno and just like totally nerded out on what are some of the things that this guy is talking about, and just kind of fell in love with the fact that there was an option. But that with that piece, I learned so much. I kind of wanted to incorporate that in the place that I was at. And again, because there's so many dollars on the table, it's hard for large brokerages to get away from that specific setup. So just kind of hit a dead end and, eventually ended up meeting Ben Conor from Conor Insurance, who really is fully adopting next-gen strategies, and just decided to take the jump and come over to Conor.
Awesome. So I want to dive into three things that you mentioned. One is this no shop conversation, because you had mentioned the fact that it's between the carrier and the broker and the employer. You had mentioned the employer, but I'm wondering if you remember back, how many times do you think one of the advisors, whether it was in your own agency, people out there in the marketplace, if you just took a swag, how many times does the advisor actually tell the employer that is on the table? Because it's been my experience, and again, I luckily I had a lot of self-funded groups when I was at Willis, so I didn't experience this as much as what I find in the fully insured world. So what's your swag on that?
Yeah, you're 100% spot on. It's none. Honestly, every time the carrier would say, if here's two renewal, basically it's like two renewal worlds. The first world is you give your employer a 15% increase. If you're going to shop us, that's going to be your offer. If you don't shop us, then the employer gets a 10% increase, right? And so as an advisor, you are left with picking the lane that you want to talk to the employer about. And that's the ethical dilemma that I think advisors face every day is, do I want to be upfront and open with this employer, or do I just want to continue cashing in on those overrides that I get from this carrier with the no shop offer? So you're exactly right. It's more than likely the employer is not really aware that those shop offers are being talked about behind the scenes between their advisor and the carrier.
Well, and when you think about it, right, theoretically, I still get to go back if I was that advisor that accepted that and says, hey, we shopped this and it came out at 15 and we got it down to 10. Right. And again, quite honestly, now what does that mean? I did less work as the advisor. I got a 10% raise. And that's what I think most employers don't understand about the relationship between their premium and when they pay brokers commission. It's just not a part of the overall conversation. How do you guys have that conversation with your employers, whether it's, about getting paid, about transparency, about, incentives, about all of that? How should the conversation go?
Yeah, transparency is key. And out of the get-go, as we're working with a prospective employer, we educate them, right, on this setup or this structure that happens with their current advisor today. So we fully explain to them, when you receive a renewal increase, when your premiums go up, your advisor gets compensated. They get a raise because of that premium increase. But are you satisfied on knowing and understanding that they receive a raise for doing nothing, for keeping you with the same carrier you've been for the last 5-10 years? And then once people are you can sense the frustration that's starting to grow or the rage that's starting to grow as they discover that. We say, here's the light at the end of the tunnel. Here's the path that would make sense, would feel cleaner, would feel more transparent, is if we become your consultant as we partner with you, we will not be compensated other than through a direct consulting agreement with you. And you're going to know in full transparency exactly what you're getting for what you're paying. And then as we incorporate some of these strategies that we're talking to you about that will improve your health plan offering for you and for your employees, let's talk about performance bonuses. Things that, we can get incentivized for being your consultant. How do we get our raises? Is by putting in the work and making your situation better year after year.
It's so funny. I'm sitting here thinking to myself, how the heck did the world get where that's just not the norm, right? Like when you really think about it, it's like, in what other scenario is somebody, like I think about my financial advisor. If and I'm going to draw on this piece of paper I have on my desk. This is impromptu. If increases are like this, right? This looks like increases. I think about that and I turn it upside down. I said, well, what if my portfolio, my financial portfolio went down? Would I, A, be okay still using the same financial advisor? And B, if I was, would I be okay that he's making more money because he's losing me money? It sounds so asinine when we talk about it from that perspective, but in our world, that's just the norm.
Mm-hmm.
The second thing is, for maybe our advisor community, it's funny. You got to have a lot of confidence to go to a client and say, hey, I'm going to charge you X and I want to make more money when I deliver more value. One, talk to me about that conversation. And two, what's typically the reaction from an employer?
Sure. So we have, I think, thanks to data, and again, the fact that FYI, for all employers listening to this, there is data available on your health plan and that data is yours. But as we have incorporated or implemented some of these strategies with our clients, we have been able to keep track record of the financial impact to their plan. And so that really has created a great base for our compensation structure to say, by the way, this strategy is going to provide you with 20% savings, which correlates then with this performance bonus for us as your advisor. So it's kind of a tiered, we call it the Conor Insurance pathway. It's a tiered approach that will show the employer in real financial time what the potential savings are with each strategy and how a portion of those savings then can be reinvested in their employees as well as in our compensation being bonus for that performance. It's like a totally foreign conversation for an employer. I have had multiple situations when an employer literally just has to take like a 5-second pause to process. Yeah, like, wait a minute. It's like totally foreign. Where did this come from? And they're kind of taken off a little bit by the approach. And I've had some, CFOs that have called me out and said, well, that's awful gutsy for you to say, you're going to accomplish the savings and, guarantee that you're going to get bonus because of those savings you're going to create for us. And I said, it's not gutsy, it's reality. It's the numbers. We can prove it. It happens over and over and over again. We can get these results. I'm confident we can get you there if we have buy-in from you and your team and you're willing to put in the work as well to support this initiative. But yeah, it's interesting to see the reactions and everybody within the room is different. The CFO is thinking numbers. The HR person is thinking, how are my employees going to react to this? The CEO is saying, where's all this been my entire life that I've never seen this before? But yeah, it's completely foreign. It's kind of fun.
I love I love the simple conversations that in our business is like you just invented, the light bulb again, right? It's like, oh, novel concept. Like I should make more money when I add value to you. And then the look that you give me is like, I just invented something that, like the tire for the first time that was round instead of square. I, I think I want to take the conversation just in case the audience listening doesn't know what some of these strategies are. Pick two strategies that you're like, man, if the world knew more about this, we would be making way more of a momentum. Pick one, and let's start with that conversation. We'll pick another one, and we'll see where this goes.
Sure. One that I consider it's the lowest hanging fruit is specialty medications. So there's these medications that are considered specialty because they're very high cost. And what people are not aware of is that these medications are now costing 30 to 40% of your entire plan spend, if not more for some companies. And there are ways that we can access these medications through alternative ways or alternative sources that literally could be no cost to both the employer and the employee. But, it's hush-hush because it's not really something that allows the big three PBMs to make the money that they make in today's day and age. So for me, that's like one of the easiest, year one type of levers that we can pull is, hey, let's carve those medications out of your current health plan, protect the plan from those high cost medications coming through it, and then we will work with a support vendor or solution that will work with each of your members to educate them on how to access this medication at no cost to them, at no cost to you. And I can tell you, I think in the 17 years that we have been working with this type of strategy, we have been able to source $21 million worth of medications for all of our clients within Conor Insurance. So again, it's something that's relatively seamless, low disruption, low noise. Usually it's very few individuals that are needing this specialty medications, but that can create such a huge impact on the health plan spend.
So I want to highlight a couple of things that you said because I wrote them down. One is 17 years, right? So somebody who's listening might think, well, wait a second, I've never heard that. Wait. It's been around 17 years. So this is not something that, was created yesterday. This isn't something that, like you're in the layer, in the witchcraft in the back room, conducting these drugs and making them yourself. And that's how they're shaped. Like, let's dig into that. Give it, if you even have an example, what's a typical drug that somebody might be on, and what financially does that benefit everybody involved?
Yeah, absolutely. So one of the most common ones that I see when we start reviewing data is Stelara. And Stelara is a medication that can cost between $10,000 to $15,000 for a 30-day supply. And that means the plan is paying for. It's not even including the member responsibility, which usually for specialty medications is a pretty high copay. Every month can be $400, $500 a month. And that's a medication that the manufacturing companies that make Stelara technically have assistance programs. So when you see a Stelara commercial, there's always like this really little writing that says, please contact us for patient assistance programs. And what those programs are about is, any person that needs this medication, if they qualify based on certain criteria, income, as well as the fact that the plan doesn't cover these medications, they can access this medication for free from that drug manufacturer. That's not new. That has been around for a very long time. And that's part of one of the requirements that drug manufacturers have to comply with when they are offering this medication out in the marketplace. So yeah, with regards to that 17 years, like that's definitely something that has been around for a long time. People just don't realize that it's there because there's an intention of not wanting to give these medications away for free. But it is there. It is available.
So let's follow that money, right? So let's just play with 10,000 because it's easy math. Like 10,000 times 12, that's $120,000 the employer is spending on this drug. A couple of questions. If I am the insurance company, we won't pick on any one, but let's just say one of the major insurance companies, and there was a way to access that medication through this other source, saving $120,000 a year, doesn't the insurance company also want to save that money? Like, if someone's listening to that saying, well, wait, why, if it's accessible, why aren't these people over there? What's your answer on that?
Well, I think there's two different things happening there, two main things, but there's a lot of other components. The first one is the fact that if this medication is being filled through the medical plan with that insurance company, there's these things called rebates that are being paid by the manufacturing company to the insurance company to offer or include this medication in their formulary, their listing of drugs that are covered within the plan. So that's a revenue source that, if I put my business owner hat on, why would I cut one of the arms that's giving me revenue within my company, right? Like no business owner in their sound mind will say, well, let's just get rid of this revenue source. I don't want to make money from that source any longer. So that's one. But the second one too is as these medications get filled within the plan with that insurance company, then they can raise premiums up as an insurance company to cover the cost of this medication. And premiums are revenue. That's really when insurance companies consider the premium you as an employer and employees pay. And again, back to the revenue conversation, which company is going to want to say, well, let's not make so much money or let's cut down on our revenue, year after year. They have shareholders that they got to report to as well. So that's just like two of the reasons why, in my opinion, insurance companies choose not to.
I have so many comments, but the word choice you did, I think, is perfect to put a bow on that conversation. Is choose. That it is a choice, right? The reality of this isn't. They don't know about it. This isn't like, oh, it's overly that hard to do. This is simply there's a misalignment of incentives that what employers and employees call premium, health insurance companies call revenue. And this other source that probably the employer didn't even know existed, rebates, are another way that insurance company is making money on that drug. And by the way, where it's positioned on that drug, that formulary that you said is a list that they make up. So, it's the cards are stacked. What about the member on that side? So you'd mentioned, maybe upwards of $400 a month on a copay. So again, not great at math, but 400 times 12, $4,800, on that. What happens in scenario A and what happens in scenario B? So I'm in the normal scenario. I am paying my $400 copay. I just keep paying that, huh?
Yeah, the first scenario, so you stay with that, or you're with that insurance company as a member. You go every month to get this medication filled. And a lot of the times member experience, this is no news. There's medication shortages out there right now. So as a member, you're also at the mercy of what the pharmacy has in stock and what they don't have in stock. And so there's not just the cost component of it, but the inconvenience and the waiting that these members have to go through to get access to a medication that's life-saving. On the other end of the spectrum, when members go through working with our partner solutions to get their medication, we can mail it to their house. So they don't have to, make the trip to the pharmacy. They can get their medication delivered at their home. The medication could be delivered for more than a 30-day supply. So a lot of the times it's a 90-day supply, which means they don't have to be thinking about this. Oh, I'm coming up on my 30-day, blah, blah, blah. Plus, there's $4,800 more that are going to their savings account that they can use to pay for groceries, pay for gas, pay for some of the other priorities that they have in their life. So there's a lot of different ways that this type of setup impacts positively a member's life too.
And I think if listeners, kind of remember this story, my parents filed bankruptcy off of one drug, Revlimid, and similar situation. Last question on this. Some of these drugs have these manufacturer's assistance program, and there's an income, thresholds. A lot of people have a misconception that the income thresholds are super, super low. Talk about some of the income thresholds that you're like, and even I remember looking at them, taking a step back saying, wow, somebody could still make that amount of money and qualify. What have you seen?
Yeah, we had a situation recently where the daughter of one of our company owners, our clients, she makes significant, amount of money. I mean, decent amount of money for working for her dad's company. And, she qualified for the patient assistance program. I think she was making like $120,000 a year. And she still was able to get her medication through the patient assistance program. I was surprised, pleasantly surprised. Right. But yeah, honestly, these income thresholds are not for, people that are making $10 an hour or $15 an hour. I mean, you just got to dig into the details, put in the work, and then the rest happens.
And again, I think in putting in the work, right, the people listen to these things and think change is hard. And I'm thinking to myself, okay, I do it the easy way. I pay almost $5,000 a year. I have a couple of conversations with the advocate who works for this company. I file a couple of pieces of paper, and then it gets shipped to my house, and I save $5,000. Let's just say that person making $120,000, $5,000 is still like 2.5% of what they make in a year. But okay, that's a good vacation. That's a down payment on a car. I mean, $5,000 is $5,000. It's just absurd. Talk to me about another one of these strategies that you're like, man, people have to know about this.
Yeah. So one of the strategies that I also encourage people to look into is bundled surgical pricing. So there is an organization in Indiana that was founded by surgeons who left the traditional hospital setting because they just got tired of working within that system, being overworked, underpaid, and not really providing the outcomes that they wanted for their patients. So they opened up this outpatient surgery center in Indianapolis, and literally were able to figure out what the true operating costs are. And based on that, provide a fair price for hundreds of surgeries available that are all outpatient. And so when you look at, and they literally list the prices on their website, like there is no secrets about what these surgeries are going to cost you. So just like we go on Amazon and we price shop or price compare for two things that we're looking at, and we look at customer reviews and ratings and all of that, like why can't we do that for our own healthcare as well? So what we have been able to see is allowing employees to access, one, the transparency of understanding how much is being paid on behalf of them for their surgery and their care. Two, allowing them to get a better health outcome and experience when they get a surgery done through this surgery center. And three, having the employer also reap from the benefits of paying 60% less than they would pay for that same surgery through a hospital setting is incredible. So yeah, we've had great experience with that. Several of our clients have endorsed and adopted the access. And one more thing is incentive-wise, if the employer or the member chooses to get their surgery at this outpatient surgery center, it's free to them. So when prior to this would likely apply towards the deductible. So let's just talk average health plan, $2,000 single for $1,000 family. So if it's a $2,000 plus some co-insurance, let's just call it $3,000. for that surgery. Now they're going to a better option, high quality, for free for them. So that's been really cool to see.
Okay, we're gonna have to unpack this because, again, obviously, I know these things, but when I like to hear, like, I love to hear other people's way of explaining it. One, and two, I just imagine somebody hearing that for the first time and being like, "WTF?" Right? Like, first of all, so I'm gonna hit three angles. Let's go quality. Are these docs that got kicked out of the major hospital? They got annexed out. These are the lowest of the lowest. They're the scum of the scum. They're doing surgeries and handing somebody a bottle of tequila for their anesthesia and cutting it with a butter knife. Like, walk me through the type of surgeons and then this facility. I mean, are they underneath some tarps and they're doing it with flashlights? Like, talk to me about this facility, because I am shocked at this day and age. There's so many people that have never seen an ambulatory surgery center and what it looks like and all of the things. Walk me through that.
Yeah. So with regards to the doctors, I mean, there's all, when I look at a hospital system, when you really look behind the curtain, there's A doctors and C doctors. And what you should be able to tell is who's who, which one's what, right? So these surgeons they are A doctors. They are like 90 to 100 out of 100 in terms of the outcomes after they perform a surgery, mortality rates, readmission rates, like low readmission rates, almost none, low infection rates. So these are like top quality doctors, objectively speaking, based on data. And these surgeons really have invested in a state-of-the-art surgery center. So you literally, like, to give you a visual, you walk in and this waiting room is peaceful. There's music playing. It's very nicely decorated. It's like you're going into a 5-star hotel lobby compared to when you go into the hospital and it's chaos, right? Like, you're trying to find parking. You go in and there's people running everywhere, people with masks, sick people. I mean, the experience is completely different. And when they do tours as well for employers and employees, if they want to come join, and you literally get to see every single operating room in this facility, and it's clean, everything is organized, well lit, relaxing for the patient, because that definitely has an impact into the success of the surgery. So it's like night and day difference between the two.
I encourage the listeners, even if you don't have to have a surgery, just go to a surgery center. I'll tell a quick story. As you know, I just had vocal cord surgery. And so I flew from here to Las Vegas because it was one of the top surgeons. And they ran, one building. Left side of the office was the office, and the right side was the surgery center. They had an app that as soon as you got into the parking lot, you checked in on your app. I'm in the parking lot. By the time I'm walking in, all of my stuff was already filled out because I did it online. For me, my assistant was able to do some things for me. Like, I get in there, I don't think my butt even hit the chair to the weight before they called me back. The surgery, I was in, out, and here was the coolest part that I don't think I realized, and I've had a couple surgeries all in surgery centers, but I don't think I realized it until this time. My surgeon came and he says, "Hey, so let me tell you about how the day is going to go. You're going to meet Jackie, you're going to meet Fred, you're going to meet Billy. Billy's the anesthesiologist. He's probably going to make some stupid joke. Don't mind him. And then at the end, we're going to have Tammy wheel you in." And the interesting part that I never really correlated is they do the same surgery with the same team every single day. Surgery center versus hospital where it's just Russian roulette. You don't know the doc doesn't know who's going to be their scrub tech and their second in command and third in command. They have no idea who the anesthesiologist is. And Tammy came and Billy came and Billy made the joke just like the guy was going to say. And then to your point, like how comfortable you feel, like these guys know each other. It was a remarkable. So it's a nice place. It's a nice surgeon. And I also think about this and says, they're playing with their own money, right? They're not at a hospital where if they screw up, the hospital's, going to take the bill. If they screw up, it's on their dime, their reputation. They've done all of this. So I also think there's a little bit of swagger and confidence that says, if you didn't think you were that good, you're probably not going to go down that path.
Right.
Summarize all of this for me. So pick a client in your head. We've talked about, the fact that brokers and carriers are misaligned. We talked about the reality of quality advisors such as yourself and your organization. Go in and have a completely different conversation. First of all, pay me when I do well. Don't pay me as much when I don't do well. Here's a couple of different tools in the toolbox. Some are low-hanging fruit. Some are super. Again, I think everything that we talked about is super easy. What does this amount to when you look at it on a bigger scale? Think of an employer that you're like, we've done this for, and then this is what they've been able to accomplish.
Yeah, absolutely. So there's one of my favorite, I would say, like my wow client is an employer located in Batesville, Indiana. They are a pellets manufacturing company, and they have about 400 employees within their health plan. And the COO of this company is actually Hispanic. So I jive really well with him from that background perspective. And I always joke, but he reminds me of, again, Colombian roots. He reminds me of Pablo Escobar, not because he is a drug lord by any means, but it's more like he's all focused on supply chain management. And he has to deal with supply chain management decisions for multiple aspects of his company, right? Healthcare being one of them. And so he's always pushing me, which I appreciate, how else can we improve this healthcare delivery for our employees? So we started working with them about 4 years ago. And at that point, they were self-funded, but they were self-funded with everything under one roof. So they were with one of the big carriers, self-funded. And year one, we made a few changes. So we kind of started peeling the onion. We partnered with an independent pharmacy benefit manager. We carved out specialty medications of the plan. And we also started providing access to a primary care clinic for their employees at no cost to them. So that was year one. That's kind of what they were comfortable with year one. Year two, then we moved to reference-based pricing, which is, again, kind of another lever that we can pull within our pathway, meaning no network. So we're reimbursing providers on a multiple of Medicare. We also extended access to primary care, not just for the employees that were in the plan, but employees off the plan and their dependents, so their families, because we saw the impact of access to primary care and the cost of the health plan. And we also incorporated the bundle surgeries, so access to the bundle surgical place at no cost to the members. So when I look back, from where they were at from a per employee per year cost to 4 years down the road, they have realized about $3.5 million in savings from a health plan cost perspective. And that is on top of, from a specialty medication sourcing, they have saved $2.2 million. So on top of the 3.5, we have $2.2 million of medications that we have been able to get to members at no cost, again, to them or to the employer. So he always, as I provide kind of the information about plan performance and where we're at and where we're going, you can see there's a grin on his face, which again kind of reminds me of my good old fellow Pablo Escobar of, yes, this is exactly where we need to be. We're doing the right things. And he gets excited, like, where do we go from here? That's probably one of my my best stories I got on clients.
And when you think about this, right? So employees have saved money the entire time, right? They've got the medications, they've got the opportunity to access the surgeries. If we were paying a lower cost and everybody's paying a percentage of a lower cost, everybody's saving money. 5 million, if my math did me right, a couple million on drugs and a couple million on the plan. So 5 million in 4 years, that's $1 million, 400 employees. You said they were a pallet, yeah. So I don't know what the net profit of a pallet is, but I'm going to assume that $1 million plus a year in savings, in order to sell that many more pallets, that your profit equals what you just sucked out in expense, is such a big deal. And so if there's anything that I urge an owner, a CFO, a CEO, even HR, these conversations, when you attribute it to how much savings can be generated when you think about how much more you would have to sell on the revenue side of your business, this is hugely impactful. I want to end this there. I hope that there are going to be some people who look like you and look like me that listen to this. You're female. We're both Latino. I want to end this with for folks that, maybe at the end of the day are like, how did these two get into this business? Like, she's a female. She just talked about Pablo Escobar being her client in such a way. Give a shout out, last minute motivation to, people who look at this business and say, it sounds boring. It's a white man's business. Talk about what you would leave a little, Colombian girl sitting here who might be picking this up in a year and 2 years, shit, in 10 years. What piece of advice would you leave them with?
There's hope. So I think from 11 years ago to now, as being part of this industry, I've seen a lot of evolution and change happen in terms of kind of what you're talking about. The insurance industry has had for the longest time a bad rep because of wrong things that have been done wrong, misaligned incentives and all of that. But what I love about this community is, as I started learning new ways on a different path, there's so many people that want to share their wisdom with you. And we don't see each other as competition. We see each other as, guys, we literally have barely tapped the surface on the change that we can make in this country. And there's plenty of potential everywhere in the country for you to make a change as well. So it's almost like there's this code of conduct. It's like an invisible code of conduct among our industry of, I'm not going after your stuff because you're making a change. I want to make a change as well. Let's partner together. Let's join forces, share our expertise, share the things that have worked, things that haven't, things that we have learned. And let's move forward with creating change together. So that's what I would tell people that are, just starting to look at this industry or are looking for light at the end of the tunnel and are in the traditional dark world. Is there is hope. You just need to, broaden your horizons, seek out other experts in this industry. I tell you, like, looking at you and some of the other big dogs in the industry, it's like you're looking at a celebrity and talking to them, but honestly, like, everybody is a real human, real person, down to earth, and really open to sharing whatever you would like to know.
I think, first of all, thank you. Second of all, I think at the end of the day, there's a why behind it, and we started, with it. At some point, people who got into this industry, like me, almost 25 years ago at this point, woke up one day and realized, me siento sucio, right? I feel dirty. Like, I've been doing it the normal way. I know there's another way, and everybody has that moment that the light switched, and I'll end everybody with this, whether you're an advisor, whether you're an employer. I look at this very similar to the Peter Parker, the Spider-Man, right? With great power comes great responsibility. And in this conversation, I think that knowledge is power. And, maybe you didn't know that these things even exist. Whether you were an advisor, quite honestly, I didn't know that some of these things existed when I was, at the top of the top at Willis. I didn't know there was manufacturer's assistance programs. It's not like I was doing it on purpose to try to screw. I was working my ass off to try to do all that I could, but you only know what you know. And that's kind of why we started this podcast. It's why we bring people on like you that want to share the story, not because you're trying to get any business out of this, because you're so passionate and can see what actually happened. So, now the call to action on this will be, the Peter Parker. Like, now you got some more knowledge. It's up to you now to decide what you're going to go do with that knowledge. So if anybody heard this and says, man, I got to work with that girl, where would they find you? How can they learn more about you or Conor Insurance?
Sure. So I'm definitely on LinkedIn. So Deanna Miller. You can look me up on LinkedIn. We also have our Conor Insurance website. So it's Conor, CONNERINS.com. And of course, if you want to contact me via email, you certainly can, dmiller@ConorINS.com. So happy to do that.
And I will give your lovely boss a shout out that he is one of the co-producers in a documentary that we have coming out later this month. And you will be seeing and hearing more about that on the podcast. But thank you for joining me today. Thank you for sharing your story. Thank you for fighting the big fight. It's working, although slowly at times. We wish it was all faster, but thanks for fighting the big fight.
Thanks, Lester. Appreciate it.
Awesome, man. Thank you for the guest. As you know, we only get to spread the word and make more of an impact when you guys spread the word. So if you got any value of this, please forward it. Please send it to somebody. If you know a manufacturing company, if you know anybody that needs to hear this, please send it out. So thanks so much, and we'll see you next episode.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.